Migraine is a disease whose main symptom is severe paroxysmal headaches. They are localized in one half of the head, which is why the disease is called hemicrania in Latin. Migraine differs from ordinary headaches accompanied by fatigue or as a symptom of any diseases by the nature of the pain and the absence of any organic causes that cause it. Migraine causes. The causes of hemicrania are still being studied, but scientists have found that the predisposition to the disease is inherited through the female lineage. That is why migraine in women is recorded significantly more often than in men. Features of the functioning of the nervous system are inherited, which become the cause of headaches under certain circumstances. The mechanism of pain development in migraine is associated with the activation of the trigeminal nerve nucleus, which leads first to spasm, and then to dilation of cerebral arteries, development of perivascular edema, which is the cause of migraine, the involvement of serotonin metabolism, disorders in the central nervous system in the formation of migraine. Pain has been proven. However, predisposition itself may not manifest itself without the influence of certain factors, called triggers. They can be divided into 4 groups. Psychological reasons: mental, emotional stress. Physiological: sleep disturbances, fatigue, hormonal changes. Food: it has been proven that tyramine, which is found in many products, coffee, chocolate, nuts, cheese, cocoa, smoked foods, citrus fruits, can provoke migraine pain development. Migraine and alcohol are also closely related. Wine, champagne, and other slightly alcoholic beverages are also disease-causing products. External factors: sharp odors, bright light, loud sounds, atmospheric pressure fluctuations, being in stuffy rooms. The causes of migraines in men and women can be related to the peculiarities of the hormonal background. In women, situations that provoke the development of pain occur significantly more often, and many scientists explain the higher frequency of migraines in women precisely by this fact. Causes of migraine in women. The cause of migraines during menstruation is a change in vascular tone under the influence of hormones, the ratio of which changes throughout the cycle. Some women experience headaches during ovulation, while others experience premenstrual syndrome or bleeding. In some cases, hormonal contraceptives help get rid of menstrual migraine. Migraines during pregnancy occur quite often, which is associated not only with hormonal changes, but also with an increase in the load on the circulatory system due to the inclusion of the fetus in the bloodstream. Migraine and menopause are also often associated, since with the onset of menopause, the ratio of hormones in the woman's body changes again. Causes of migraine in children. In children, migraines are usually associated with overwork, which occurs with heavy workload at school. Another common cause of migraine is hormonal changes occurring during puberty, which is why adolescent migraines are so frequently recorded. Migraine symptoms in children are more difficult to detect, especially at an early age when the child cannot clearly formulate their complaints. The symptoms of migraine in adolescents usually correspond to those in adults, so the diagnosis of the disease is not difficult. Symptoms and signs of migraine. The main symptom of migraine is a strong pulsating headache. Usually, it is unilateral and localized in the frontal temporal region, but there may also be a different location of the pain focus. In addition to pain, there are other symptoms of hemicrania: nausea or vomiting, decreased appetite, increased sensitivity to light, sounds, tastes, and smells, dizziness, sleepiness, irritability up to aggression. Types of migraine. Disease symptoms are determined by the form of migraine, which are several. The duration of the attack is individual. It can last from 2 to 72 hours. Migraine symptoms in men and women do not differ significantly. The difference is only in the frequency of attacks. In women, they are usually more frequent. Migraine with and without aura is distinguished. Aura is a complex of neuropsychological symptoms that anticipate the onset of pain, becoming the first signs of migraine, or developing simultaneously with the pain syndrome. They are caused by the spasm of cerebral vessels, which occurs at the initial stage of the attack's development. Types of migrainous aura. Visual: flashes, fog, flashes, distortions, loss of visual fields. Auditory: tinnitus, auditory hallucinations. Sensory: change in taste, smell. Aphatic: speech impairment. Motor: difficulty in limb movement, including walking. Vestibular: dizziness, possible falls due to loss of balance. Types of migraines. A simple, classical form of the disease, and migraine with focal, neurological symptoms are distinguished, which in turn can be of several types. Migraine without aura presents with episodic headaches, aura symptoms, and no neurological deficit. Migraine with aura is accompanied by characteristic neuropsychological symptoms of various types, described above. Neck migraine is a symptom of impaired blood flow through the vertebral artery. In this condition, very severe headaches develop. Chronic paroxysmal hemicrania is characterized by episodic short-term migraine symptoms, usually lasting no more than half an hour, which recur several times a day. Bacillary migraine is a rare form, the symptoms of which significantly disrupt well-being. It is characterized by dizziness, discoordination, dysarthria, paresthesia in the extremities, tinnitus, visual impairment, and in some cases loss of consciousness. The main symptom is a severe headache that can last up to several hours. After the attack, the patient falls asleep. Bacillary migraine usually occurs in girls during adolescence, puberty. Ophthalmic. Migraine is a form of disease whose mandatory symptom is the loss of image in certain fields of vision, flickering, flashes. The seizure lasts no more than half an hour. The cause of the ocular form of the disease is a disruption of blood circulation in the occipital, part of the cerebral cortex. Ophthalmoplegic migraine is characterized by eye movement disorders, diplopia, ptosis midria on the side of pain. They are associated with the compression of the oculomotor nerve by swollen vessels, cavernous sinus, carotid artery, and the spasm of the artery that supplies this nerve. Retinal migraine. Headache is accompanied by transient blindness associated with retinal vascular spasm. Hemiplegic migraine is accompanied by weakness in the body and limbs, paresthesia on the side opposite the headache focus, which is associated with impaired cerebral circulation. Usually the attack lasts no more than an hour. Aphatic migraine. Speech disorders occur at the height of pain. Abdominal migraine is accompanied by severe abdominal pain, nausea, vomiting, and diarrhea. This form is characteristic of childhood. Headless migraine is an aura without headache, most often visual. It occurs very rarely and is even less commonly diagnosed. How to diagnose migraine? The diagnosis of migraine is usually made based on complaints, after a conversation with the patient and their examination. A description of the nature of the pain and the accompanying symptoms is sufficient. Nevertheless, patients often complain of headaches, and their causes can be very diverse. So instrumental examinations are often conducted to clarify the diagnosis. To rule out organic pathology of the central nervous system, magnetic resonance imaging, MRI of the brain. Cervical spine is performed. Changes in the state of the head and neck vessels. Blood circulation disorders in them can be detected using ultrasound Dopplerography, USDG. A consultation with an ophthalmologist is mandatory, especially if eye migraine is suspected. Examination of the fundus of the eye allows us to indirectly assess the state of the cerebral vessels. What helps with migraine? Migraine treatment includes two approaches: assistance during an attack, preventive measures to reduce the intensity and frequency of attacks. How to relieve headache and migraine. When the first signs of migraine appear, it is necessary to exclude, if possible, all external influences that provoke pain. A universal recommendation is to place the patient in a quiet, dark room with open windows. Headache can be reduced using non-medicinal agents, point massage of active points, cold compresses on the forehead, needle reflexotherapy, and neck massage. Sometimes cold or, conversely, warm shower, bath, and head washing are good for patients.